Langerhans cell histiocytosis. Definitions. Langerhans cell histiocytosis is a proliferation of dendritic mononuclear cells with local or diffuse organ infiltrations. Most cases affect children.
In all layers of the epidermis except the stratum corneum, which protects against infections, and are most prominent in the stratum spinosum. They also occur in the papillary dermis, particularly around blood vessels, as well as in the mucosa of the mouth, foreskin, and vagina. They can be found in other tissues, such as lymph nodes, particularly in association with the condition Langerhans cell histiocytosis, LCH. In skin infections, the local Langerhans cells take up and process microbial antigens to become fully functional antigen-presenting cells. Generally, dendritic cells in tissue.
Applications in nursing. Laboratory studies used to define the extent of the disease included the following: complete blood count with differential count, complete metabolic panel, analysis of the first morning urine. Diagnostic imaging studies include of the following: ultrasound of the abdomen, MRI of the brain to evaluate the pituitary gland, MRA of the colon.
Hi, my name is Dr. Ken McLean. I'm a pediatric hematologist-oncologist at Texas Children's Cancer Center in Houston, Texas, and I'm the clinical director of the histiocytosis. Histiocytosis is a general term for several diseases of these white blood cells called histiocytes, and the histiocytes have the ability to change their form and their function and look differently in these different diseases. But just as a general class, the histiocytoses are diseases where there are too many of these cells along with some other cells collected in some place in the body and causes the disease. The estimate is that there are between 5 to 8 per million children affected by Langerhans cells.
Pros and cons. Pros. Treatment. People with Langerhans cell histiocytosis that involves a single area can be treated with local surgery. However, there will need strict monitoring for symptoms that indicate that the disease has spread. Cons. Symptoms: abdominal pain, bone age, delayed puberty, dizziness, chronic ear dryness.
Hi. The different variety of presentations or the ways patients can come about to have LCH are hugely variable, from a baby who might just have a single skin lesion that'll go away by itself to really life-threatening disease that can look a lot like acute leukemia and require very severe treatment. There's a cell called a Langerhans cell that we all have in our skin, and the job of this cell is to be the guard against all the germs in our environment. It tells the immune system certain germs it's supposed to fight, or certain germs that it's not supposed to fight against. And because this cell in our skin looks very similar to the cell in LCH lesions, the assumption has been that LCH comes from this skin cell that sort of goes berserk for some reason. And what we've learned through our research is that, in fact, the Langerhans cell in the skin has been incorrectly blamed for causing Langerhans cell histiocytosis. And in fact, LCH arises from a different part of the
Issue applied in Ecuador. Langerhans cell histiocytosis is a rare disorder that can affect people of all age. The highest rank is found in children between 5 to 10 years. Some forms of the disorder are genetic, which means they are inherited.
This new center that we've created is for patients with histiocyte disorders, which are a very rare group of diseases involving a family of immune cells called dendritic cells or histiocytes. And because of their rarity, for a long time, unfortunately, both the clinical care of these patients and the science behind the diseases has lagged behind some of the more common diseases that we see and that we manage. And thankfully, centers like this and others that we work with across the country and across the world are really starting to change that. The idea was to basically create a home for these patients, to have a place where they could go, both to see clinicians that have expertise in the diseases, but also to learn about some of the new science and some of the new treatments. And if they're interested, participate in a broader community, whether that's interaction with other patients who have these diseases or participate in some of our research efforts.
Conclusion. Langerhans cell histiocytosis is a rare cancer that begins in HCl cells. HCl cells are a type of dendritic cell that fights infections. Sometimes mutations occur in HCl cells during their formation.
Now we try to avoid that name, and now we just call it Langerhans cell histiocytosis. So either my instructors were teaching it to us wrong, giving us an outdated name, or really the naming convention has changed fairly recently. This is going to be really brief. I gear my lectures towards the USMLE, and unless you're taking oncology boards as a specialty, which, my lectures are certainly not enough for that, you're not going to need to know a whole lot about Langerhans cell histiocytosis. It's fairly rare. Only about 300 or 400 cases are diagnosed in the U.S. per year. You may need to know a little bit more if you are going into pediatrics, because this is primarily a disease of children. About 75% of cases occur in children. But for board-related purposes, there's only a few things you need to know about this, really just how to identify it, not so much how to treat it. If you haven't had the opportunity yet, please consider subscribing to my Patreon. Most of the versions of Langerhans cell histiocytosis, and yes, I did say versions, are not deadly. There is one that is life-threatening. But for the most part, these are fairly benign, but they can be very disfiguring.